My name is McDonald. I'm a mental health counselor and I specialize in treatment of eating disorders. This video blog is to describe a therapy that I developed called Relational Exchange Therapy. It's interesting to me that the instrument with which we understand all things, the mind, is the instrument about which we understand so little. If you ask most people, why do we function the way we function? What determines a psychological outcome? Why are some people more psychologically healthy than others? Most people will tell you that it's because of early childhood experiences, whether or not you were traumatized and neglected, or whether you were complimented and hugged. And people also cite biological and genetic variables. But I think that many people don't really understand how the mind works. And RET is an attempt to lock what we know about the mind into a system that's predictable, a system that we can navigate, a system by which we can actually create our own psychological outcomes. I want people to be empowered. I want people to be able to know that they can determine whether or not they're depressed, anxious, have an eating disorder, have relationship problems, or not. And in order to be able to do that, you have to have a system to lock this information in. There are many theories in psychology, but I think that we're missing some very critical pieces, and I also think we're overlooking some pieces that really determine whether or not we function the way that we should function. Just like with the body, you know, if you look at the body has systems. It's a series of interlocking systems, and it's because we understand those systems that we're able to determine whether or not we're physically healthy. We're able to eat what we should eat and exercise and rest, and we can navigate that system, and it's allowed us to achieve better physical health. But the mind, unfortunately, doesn't have a system, and RET is an attempt to create such a system.